Leader of the third party.
Thank you, Honourable Speaker. Perhaps something that we can all agree on. As we've just honoured on the South Lawn, firefighters put service over self, risking their lives every day for our communities, a fact that has become all the more poignant as climate-fueled wildfires impact every part of our province. Firefighters across BC have raised concerns about health and environmental risks from per- and polyfluoroalkyl substances, PFAS, carcinogenic forever chemicals they're exposed to in their workplaces. Yet PFAS are still widely used in fire suppression foams. On the day of the BC Fallen Firefighter Memorial, it's vital that we heed their concerns. Honourable Speaker, through you to the Minister of Public Safety and Solicitor General, will this government invest in the health of BC firefighters by transitioning to PFAS-free fire suppression foam?
Minister of Public Safety.
Thank you, Mr. Speaker. Thank you to the member opposite for the question. Firefighters put themselves in the line of danger every day and as they save life and property. While many firefighters are paid employees, many of them are volunteers. We recognize this. In fact, most communities in British Columbia rely on volunteer firefighters to protect their property, and I commend them all for the service that they do to this province. Our government supports fire departments through investments in training and equipment. Since 2017, more than $17 million has been provided to firefighters and composite fire departments through the Ministry of Energy Management and Climate Readiness. Last year, the province provided more than $6 million for 122 local projects supporting 200+ fire departments. Mental health peer supports for all 15 volunteer fire departments in the Cowichan Valley, upgrading and replacing equipment for Sandspit volunteer firefighters, new relay tanks, hands-on training, personnel and demonstration props, all to fire departments.
Thank you.
I am pleased to be meeting this week with some of these firefighters, and I'm going to continue to work with them for the safety of the province.
Thank you. Leader of the third party supplemental.
Thank you, Honourable Speaker. While we appreciate the recent strides that have been made, our firefighters deserve better. Studies suggest that firefighters are 3 times more likely to die of cancer than the general population. Cancer is still the leading cause of fatality claims among Canadian firefighters. Despite being classified as one of the most high-risk occupations for carcinogens, firefighters across the province are unable to access coverage for early cancer screenings that could be life-saving. Through you, Honourable Speaker, to the Minister of Health, will this government commit to a proactive health screening program for firefighters to ensure we are looking after those who look after us?
Minister of Health.
Thank you so much, Honourable Speaker, and thank you so much to the member for the question. And it is a good question to ask today because we have the firefighters here with us, and of course, over the lunch hour, we had the opportunity to celebrate and to mark the incredible dedication that these women and men have and how they put their lives on the line. And Mr. Speaker, that includes, as the member refers to, the exposure to carcinogens and to other aspects of danger that can really put their lives in risk. And Mr. Speaker, supporting the health and well-being of frontline workers like firefighters is one of our top priorities. And being able to access early cancer screening for the prevention and detection of cancers is a key plank in helping to keep all people in British Columbia safe and well. We offer 4 different cancer screening programs here in British Columbia, Mr. Speaker. But of course, we need to be continually reviewing those criteria and ensuring that people, especially groups of our populations like firefighters who could be at more risk, are there. So, Mr. Speaker, I've had the opportunity to meet with the BC Professional Firefighters Association on this. I've heard them, and I've asked BC Cancer to review the criteria that are used and the issue of recognizing the unique risks that firefighters may face, and I look forward to reporting more on that. Thank you again.